The theme of this year's World Pharmacy Day, think health, think pharmacist. Any patient that comes to the hospital, majority of them must go home with one drug or the other. So they come to the hospital, they don't see the pharmacist, it's not complete. The pharmacists are a very crucial member of the health family. And just like the MC said, in this hospital, we work as a team. We ensure that every profession in the hospital is carried along in the scheme of things, because no single one is to be underrated. For us, even the cleaner is very important, because if this place is supposed to not sit down. So all of us, we see ourselves. Importance in the past, we have always run to the DRF for rescue. Because our DRF in this hospital always funded. They always have money. And we have been borrowing and borrowing. We are paying back sometimes. So the drug revolving fund of this hospital has been very good and have been serving the patients and serving the community effectively. So we must thank them for keeping the light going, and we hope that we'll continue to do that. There is some proposal going on, trying to bring in some private pharmaceutical agencies into the various hospitals. I told them in my hospital I don't need it because my DRF is working very well. Now, the Pharmaceutical Society of Nigeria and the pharmacists in this country are going through a transformational stage. I say so because they are taking on new responsibilities as consultants. And what that means is that they are going to offer us more specialized services. And I told my pharmacists, I say, if you want that position, you must prove that you are now becoming specialists in different fields of pharmacy. We have cancer patients, so we should have oncology pharmacists, we should have pediatric pharmacists, we should have geriatric pharmacists, and the rest of them. This is aimed at providing better services to our patients. And I hope that you will take up the challenge and provide this as we go along. Finally, I want to congratulate you for celebrating this day. Like you said, think health, think pharmacists, and surely there is no way we'll come to the hospital and will not remember a pharmacist available. So I wish you a very fruitful deliberation and a happy celebration, and God bless you all. Thank you.
Thank you very much, the medical director, sir. It's always a delight listening to you because of your position and disposition to favorable changes. Thank you very much. Somebody went to a hospital and he came out of the hospital and his friend asked him, "Ina maganin da aka baka?" Yace likita bai rubuta magani ba, yace ba asibiti ka tafi ba, ka koma. Kakuma. In other words, came to the hospitals, consulted with the doctor. On his way out, a friend asked him, "Where are your drugs?" And he said that the doctor did not prescribe any drugs for me. And the friend said, "Go back. You have not seen a doctor. It isn't an hospital that you go to, because there's no how you can step into a hospital and leave without a drug." This one is dedicated to all the pharmacists. Please put your hands together for yourself. We continue to appreciate what you are doing. The next item is the remarks. Okay, let me call it what it is. Opening welcome address by the host. May I, with humility, invite the head of pharmacy department, the director, pharmacist Mrs. Tenia Inde, to the high table as she makes her way. May I equally invite the president, may I recognize
Thank you very much. I decided to come up here because when your guys are sitting down, you should speak standing. The chairman of the occasion, Pharmacist Aminu Bashir, FPSN, PAMSEC, Ministry of Health. Special guest of honor, Pharmacist Ahmed Ibrahim Yakase, MNI, Fellow Pharmacy Society of Nigeria, MD, CEO, Pharma Plus, Nigeria Limited. Pharmacist Kamilu Mudi Salisu, DPS, Ministry of Health, ably represented here. Pharmacist Gali Sule, FPSN, DG, KS, DMCSA in absentia. The chief host of this occasion, the medical director of this hospital, Dr. Nuruddin Isa. The head of clinical services, Dr. Mustafa Rabiu, thank you for being here. The keynote address speaker, one who they said his tibia was caught in this place, Professor Mohammed Galba Magaji, Dean Faculty of Pharmaceutical Sciences, ABU Zaria. Our guest of honor in absentia, Pharmacist Mutala Umar, the chairman, Pharmaceutical Society of Nigeria, Kano chapter. He's also very busy today because he has a lot of activities. Professor Ibrahim Adamuya Kase, Dean Faculty of Pharmaceutical Sciences, BUK. He was our keynote address speaker last year. Thank you, sir, for always associating with us. The Commandant, NDLEA, Kano State, the NAFDAC Coordinator, Kano State, Pharmacist Musa Abdullahi, Director of Pharmacy, Fellow Pharmaceutical Society, College of Pharmacists, rather. My Oga, our invited guest, Pharmacist Aliu Usman, a Happin's chairman. He's represented by Fam Bruno Ibrahim, also an alumni of this institution. I also want to acknowledge our grandfather in the profession, Pharmacist Usman. Please let's put our hands together for him. He's always heads of departments of this hospital associating with us. Other members of the hospital, I can't see everyone, but we appreciate everyone who is sitting down here. Put your hands together for yourself. Thank you so much for associating with us. The chairman of this occasion, our distinguished and trailblazing pharmacist, Pharmacist Aminu Bashir, the first pharmacist to be a permanent secretary in Kano State. Please put your hands together for him, with immense contribution to the profession and the healthcare system, and remaining a shining example. We greet you very warmly. Our guest of honor, Pharmacist Ahmed Yakase, MNI, past president of the Pharmaceutical Society of Nigeria, a man of immense vision and achievements. Sir, we celebrate you not only for your recent book, The Pharmaceutical Industry and Drug Production in Nigeria, but we also celebrate you for being a voice and influence for pharmacy globally. Little wonder he's fondly called the Lion King of Pharmacy. Thank you, sir. We really appreciate your presence. He has another program, but he's here today at 2 o'clock again. And Pharmacist Kamilu Mudi Salisu, the Director of Pharmaceutical Services, distinguished pharmacist and a true man of honor. He's represented here, please, Pharmacist Mustafa. Let's appreciate him. Thank you very much. Our chief host and medical director, Dr. Nuruddin Isa, a true leader who has given us the leeway to practice pharmacy the way we ought to. And like he said, he was one of the first in the Northwest to appoint pharmacy consultants. Please clap for him very well. And the challenge he has given to us, we have taken it up. Yes, we want to give specialized services to the hospital, and that is why we are putting a lot of things in place, and we want to ensure that all the specialties that are needed in this hospital, you know, are filled up. Thank you very much, sir. We appreciate you. Our keynote address speaker, Professor Magaji Mohammed Garba, Dean Faculty Pharmaceutical Services, Ahmadu Bello University Zaria, an excellent academician and a proud alumnus of this hospital. We are honored to have you. Your presence here today is both an inspiration and a reminder of the impact the hospital has in shaping giants in pharmacy. Thank you very much. We appreciate you. Our chairman, PSN, we are still expecting him, but in absentia, we want to appreciate him for all that he's doing. He has done a lot of new innovations in the society, and this year, Kano State will be hosting the conference. So we want to plan and invite you ahead. Come November, Kano will be filled up. And of course, our distinguished guests, colleagues, friends, partners in health, our supporters, the pharmaceutical companies, and everyone who has supported us to put this program together. Like we said, you are too numerous. We can't mention you all, but we really appreciate you. Please, let's put our hands together for them. Yesterday, we had a medical outreach to the Guamaja Society next to us here, and it was a huge, huge success. Thank you very much. The team reminds us, think health, think pharmacy. Reminds us that behind every pill dispensed, every prescription verified, every patient counseled, and every supply chain managed, there's a pharmacist ensuring safety, accessibility, and quality of care. To think of health without thinking of pharmacy is to imagine a house without a foundation. Pharmacists are not just dispensers of medicine. We are guidance of safety, advisors in therapy, educators in the community, and innovators in science. We work hand in hand with doctors, nurses, and every other professional in the healthcare team, ensuring that our patients live not only longer, but healthier and safer lives. One of the highlights of today's program is the inauguration of the Pharmacists Alumni, NOH Dala. This is not just another association, it is the beginning of a legacy. Our interns should not see this training as a one-year stop, but as the beginning of a lifelong journey. Through technology, they can connect with skilled professionals around the world, gaining mentorship and guidance, no matter the distance. An alumni body ensures that those who have passed through here can give back by supporting, mentoring, and inspiring the next generation of pharmacists. In doing this, we build a circle of excellence, the older lifting the younger, and the younger growing to lift others. As we celebrate today, let us all remember, in the hospital, in the community, in research, in industry, and in administration, the pharmacist remains a pillar of health. So when you think pharmacy, when you think health, think pharmacist. When you think quality, think pharmacist. When you think safety, think pharmacist. On behalf of the pharmacy department and the medical director of this hospital, I want to once again say thank you all for coming and for celebrating with us and for supporting the future of pharmacy. Happy World Pharmacists Day.
Thank you very much, ma'am. Thank you very much. Think health. Think health. Thank you very much. This is specially reserved for the pharmacist. Distinguished ladies and gentlemen, before we progress, I tender this unreserved apology for a mix-up about the information I had earlier passed. While introducing pharmacist Aminu Usman, I mistakenly alluded to the fact that he is the first fellow of the Pharmaceutical Society of Nigeria. He is actually the second, and the first is no any other person but pharmacist Ahmed Yakasi MNI Kachallan Kanu. So please, this is the right context. A round of applause for that, please. Thank you very much. Thank you very much, sir. I sincerely apologize for that mixed up. We are going into goodwill messages, and we intend to make very good use of a very limited time. So we want to beg on successive people that will give us a goodwill message that please try as much as possible to be concise within 2 minutes at most. 2 minutes. So without much ado, I've been directed to invite the representative of NAFDAC, Commandant NAFDAC Kano here. I mean the director of NAFDAC here, Kano, your representative, Pharmacist Gimba. Please, will you step up here for your goodwill message? Gimba, oh, please a round of applause for him. Please, let's make it within 2 minutes, sir. I will appreciate that.
I'll try as much as possible to do it less than 2 minutes, inshallah. The chairman of the occasion and all members present at the table and every other person here present, good morning to you all. First of all, I am actually delighted to be here present. And I wish to let you know that I'm actually representing my state coordinator, who happens to be in another occasion now. Because actually yesterday we had a very rigorous inspection. So he was unable to attend to a lot of our clients. So he had to be in the office today. That's why he could not join the program today. So he wishes to extend his appreciation to this, the invitation as well. And NAFDAC office, Kano here, we sincerely appreciate you for hosting yet again another World Pharmacists Day here in Dala Orthopedics. So Dala Orthopedics, congratulations to you. And once again, before I leave the podium, I really want to say this because it's really actually an honor for me again to witness. I'm actually going to witness yet again another lecture from one of our professors here, who happens to be my lecturer, Professor Magaji. You're welcome, sir. So thank you very much, sir, for this occasion.
Thank you very much. Indeed, you did control the time, as your name implies. The next is, may I with humility invite our pharmacist Musa Abdullahi, the Director of Pharmacy AKTH, for his own goodwill message. You are welcome, sir. A round of applause for him, please. Put your hands together. Thank you.
Good morning, all. The chairman of the occasion, the infatigable CMD of this wonderful hospital of breaking and making bones, the Katalla of Kano, and other invited guests on the high table. Good afternoon, all. I'm very happy to be here for the second time. I could recall when last year I was here, I made a promise that inshallah we are going to beat Dala. we'll do our own in such a way that anybody who hears Pharmacy Day will only think of AKTH. But what I miss from last year, when I look at my diary, I realize I didn't jot that promise. And you see, whatever is not written, they say is not done. But mine is not going to be done, and it was not done. So, but this year I promise I will write it in my diary so that I will not forget. On this note, I want to sincerely appreciate the courage and the willpower of the HOD pharmacy here in Dala. If you could remember, she said, when she mentioned my name, she said her Oga. I recall when I was in Dambata as the head of pharmacy there, I think she was there doing her service or internship, I can't remember. NYC. Okay, NYC. So I'm very happy at least to have somebody whom I have trained to outshine the master. But I will caution you, in the 48 Laws of Power by Robert Greene, he said, don't outshine your master. On this note, I want to thank you for yet another Pharmacy Day. Thank you very much. Happy celebration. Thank you.
Thank you very much, sir. You shortened my mouth. Actually, I had wanted to say you can now see, confirm, Dala is the eldest, AKTH is the junior, but like you said, we will never try to outshine the master. Thank you very much. Next is, may I with humility invite an erudite scholar and a pillar in the pharmaceutical profession in the person of Professor Ibrahim Adamuyaka, say the Dean Faculty of Pharmacy, to please stand up and give us, please, a round of applause for him. Befitting. Thank you very much, Prof.
The chairman of today's occasion, the chief medical director of this great hospital, all other protocols duly, respectably observed. I think it is both an honor and pleasure on behalf of the Bayero University, Kano, to stand before you today to celebrate this World Pharmacy Day under the powerful and timely theme that think health, think pharmacists. Now, I tend to wonder why this theme, think health and think pharmacy. You know that because pharmacies are no longer just the dispensers behind the counter. They are no longer dispensers behind the counter. We are frontline health providers. We are educators. We are advocates. We ensure safe medication use. We prevent diseases from happening. We promote public health. And increasingly, especially in underserved area, we are often the most accessible point of care. This theme reminds policymakers, healthcare system, and the public that when you think about vaccination program, think about what? Thank you. And when you think about chronic diseases management, think about what? And when you think about preventing drug misuse, what will you think? And also, when you think about affordable, accessible healthcare, yes, yet think about what? You see? So we are wonderful. We are partners in progress, right? But let me remind you that, remember that with the recognition comes responsibility. With the what? We said recognition comes what? With the responsibility. As pharmacists, we must continue to grow, to stay updated, to lead ethically, to advocate for stronger pharmacy policies, and most importantly, to put patients at the center of everything we do. So today, let us celebrate. Today, let us honor our contributions, but let us also recommit to education, to service, to leadership, and to build a world where when people think about health, they think about. Thank you very much. Congratulations.
Thank you very much, Prof. At this point in time, may I, with your humility, invite the president of chairperson of the Association of Ladies Pharmacists in Kano here, Pharmacist Safinat Isa. Please step forward. Please put your hands together for them. Thank you very much.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. The chairman of this occasion, the Kachalan Kanu, our hosts, the medical director, the chief medical director of Dala Auto Hospital, and all other members of the hospital, I greet you warmly from ALPS. I have the correction to make. I'm not the chairperson of ALPS. I'm just representing her. She's otherwise engaged in the work against drug abuse in Kano. So on that work, that's why she's not able to be here. So all she said, as she says, congratulations to the pharmacists of Dala for always leading and holding on and giving us opportunities to think and try to be better. And she said I should congratulate the CMO for being a trailblazer in recognizing the consultant gather of pharmacists. Can we put a round of applause? So, Dala pharmacists, you have a challenge. He said it. The director of pharmaceutical services said it. So, the ball is in your court. By the time we come here next year, we will want to be celebrating a specialist in oncology, a specialist in internal pharmacy, a specialist in all other areas that are going to give and deliver best practices of pharmacy to the clients, the patients of Dala Orthopedic Hospital. Thank you, and I wish us all a good celebration.
Thank you very much, Ma. May I, at this point in time, invite to the podium Pharmacist Zuhaila Maruf. Pharmacist Maruf is the coordinator, West African Postgraduate College of Pharmacists. Ma, you are welcome. Please, a round of applause for her. Thank you very much. Goodwill messages. Time, just 2 minutes. Thank you, Ma.
Thank you very much. The chairman of the occasion, the chief medical director, National Orthopedic Hospital Data, the Kachallan Kanu, permit me to stand on existing protocol. Due to time constraint, and because we have another program scheduled for the West African College, I will make my remarks very short. But on behalf of the national chapter and the Kano State chapter of the West African Graduate College of Pharmacists, we are very happy to see that one of our own fellow Tini, is blazing the trail. But she couldn't have made it without the support of her chief medical director. And as we have a Zoom meeting in the next few hours that borders on the theme of this year's Pharmacy Day of Think Health, Think Pharmacist, with the topic of pharmacists as partners in healthcare, advancing health access, patient outcomes, and achieving universal health coverage. We look forward to seeing you there. And we think that this theme is quite appropriate because for what all the other speakers have already said, which I do not need to reiterate, it is definitely so. You think health, you must think pharmacist. Thank you very much.
Thank you very much, Ma. Thank you very much. The next goodwill message is to be delivered by pharmacist Aminu Usman, the eldest, one of the eldest pharmacists in Kano and the immediate past coordinator of the West African College of Pharmacists. Thank you very much, sir.
Chairman of the occasion, Permanent Secretary Minister of Health, in the person of Al-Haji Aminu Bashir, official guests of honor, His Excellency, Consul General of Pakistan in Nigeria, His Royal Highness, the Kachala of Kano, Alhaji Ahmed Ibrahim Yakasai, the Chief Medical Director of the Orthopedic Hospital, Dr. Nuruddin Isa, Director of Pharmaceutical Services, the Orthopedic Hospital, keynote address speaker, Professor Makaji Mohammed Garba, the Pharmacy Council Officer in Kano, Hajia Asia Abubakar Ladan, other distinguished members of the high table, Assalamu alaikum. Actually, when I saw my invitation as a guest of honor, my first thought that I'm not a guest in Dala Orthopedic Hospital. Dala is my home. I could remember in the early 80s, that's about 45 years ago, the first director, we were just like brothers. When I was in the state medical store, I was illegally supplying drugs to Dala Orthopedic Hospital. And I often used to come, especially in the afternoon, to come and dispense. I'm very proud of that. Up to now, the first director, who has retired about 6 years ago, he still calls me my brother. So I'm glad that it is the hospital that is honorable. Otherwise, I wouldn't have been a guest of honor. I'm very proud that the administration in the Orthopedic Hospital is the most effective in all federal health institutions in Nigeria. When the issue of drug revolving fund came, all teaching and specialty hospitals were invited to Lagos, but it was only Dala Orthopedic that sent its pharmacists, Mr. Wanatunde. And when we introduced the fellowship of the West African drugs, West African Postgraduate College of Pharmacists, it is only Dala Hospital that has sent almost all its pharmacists. I'm sure by today, almost all the pharmacists in Dala Hospital are fellows of the West African Postgraduate College. I'm very proud of that. So at the theme of the celebration is Think Health, Think Pharmacists. What I have to recall is what the Director General World Health Organization, Dr. Hiroshi Nakajima, in 1983. His first address to the world was that Without drugs, without the function of pharmacies, health services is of no consequence. I retain that in my mind, that without a pharmacist, you cannot have any meaningful health services. So I have to say that I am proud pharmacists are celebrating this day, which was declared by the International Pharmaceutical Federation. I hope this will continue. When I came last year, I thought it was World Health Day, not World Pharmacist Day. At that time, I noticed that there were more nurses than pharmacists in this hall. So I found out why this response, because in the doctor hospital, there is no father or mother, we are all brothers and sisters. The administration has recognized the pharmaceutical services in this hospital. That is why it supports every activity of the pharmacy department. So I have to thank the administration for this hospital. I pray this support will continue. And also, as the chairman pointed out and the chief medical director, the most important thing in every activity is teamwork. I'm sure without teamwork, this hospital will not have reached the position it has reached now. So I'm calling for all hospital workers, from the surgeons, physicians, pharmacists, nurses, the therapists, and even the laborers, to collaborate and work as a team. That is how to achieve success in every field. Teamwork is very, very important. So I hope they will continue the next successive years and pray to be here as long as we live. I wish you successful deliberations and pray that the outcome of this will be extended to all other professions, not only pharmacists. There may be a Nurses Day, World Nurses Day, World Laboratory Scientists Day, and so on. But with teamwork, everything will be a success. So I wish all of you successful deliberation. Thank you, and goodbye.
Gently, sir. Thank you very much, sir. Quickly, may I recognize the presence of Madam Lawal Abubakar. Madam Lawal Abubakar is the Imam of the mosque in the Gomaja housing estate, very close to us here. Sir, you are welcome. We recognize you. Just put your, thank you very much, sir. We are proud to be associated with you. Thank you, sir. May I equally recognize the representative of the DG, Kano State Drugs and Medical Consumable Supply Agency, represented here by Pharmacist Aminu Detti. Pharmacist Aminu Detti will recognize you. Thank you very much. We are proud of the work you are doing for humanity. Thank you very much. Equally, may I quickly recognize the presence of Pharmacist Asia Abubakar Ladan. Pharmacist Asia Abubakar Ladan, well, you are welcome. Thank you very much. Pharmacist Ladan is the head of Pharmaceutical Council of Nigeria, Kano office. As I recognize you, may I with humility invite you to the podium for just 2 minutes goodwill message. Thank you very much. Distinguished ladies and gentlemen, we are gradually approaching the end of this segment of the program. We just have 2 speakers to take after this, and we are done. Then we make progress. Thank you for your perseverance and for your support.
Thank you. Good afternoon, everyone. And the chairman of the occasion, the permanent secretary, Ministry of Health, Pharmacist Aminu Bashir, the special guest of honor, Pharmacist Ahmed Ibrahim Yakasai, Kachallan Kano, and the chief host of this occasion, Dr. Nuruddin Isa, the MD National Orthopedic Hospital, Dala, the keynote address speaker, Professor Muhammad Garba Magaji, and the guest of honor, Pharmacist Kamilu Mudi Salisu, along with Pharmacist Murtala Isa Umar. Good afternoon, everyone, and it's truly a honor to be here to give a goodwill message on behalf of the Pharmacy Council of Nigeria, Kano State Office. The World Pharmacies Day, the theme for this year is Think Health, Think Pharmacist. It cannot be coming at a more decent and right time. I am truly honored and glad to be here today. Good morning, sirs. I came a bit late, so I would just say good afternoon to everyone, and I wish us all a very beautiful conference.
Thank you very much. May I quickly recognize Pharmacist Siaka Onimisi. Pharmacist Siaka Onimisi, please, wherever you are, I duly recognize you. You are welcome. He is the chairman of National Association of Industrial Pharmacists, I believe. You are welcome, sir. May I equally recognize the presence of Pharmacist Gashon Dashi. Gashon Dashi, please, you are welcome. Thank you very much, Mr. Gashon. May I equally recognize the presence of Malang Aliyu Musa, the manager, Union Bank of Nigeria. Thank you very much. I remember you were here with us last year. I have a debt to collect from you. I did a lot of marketing for you last year. Thank God I've seen you. Thank you very much, sir. You are welcome. Don't mind me. All right, thank you very much. At this point in time, may I quickly invite to the podium Pharmacist Mustafa Ibrahim Usman. He is representing the Director of Pharmaceutical Services, Kano State Ministry of Health. Sir, you are welcome. Thank you very much. Like I said, you will be the second to the last. And after that, we take the last goodwill message and we draw the curtain on this segment. Thank you, sir. You are welcome.
The chairman of the occasion, Pharmacist Amir Bashir, the Permanent Secretary, Minister of Health. I don't know how to say, is it the father of all pharmacists of Kano or Nigeria or Pharmaceutical Society, the Kachala of Kano, who is the mentor of all the pharmacists in Kano and beyond. Also the MD, Pharma Plus Nigeria, also the CMD of this great hospital, Dr. Nuruddin Isa, the keynote address speaker, a very young professor, very ambitious, Professor Magaji Mohammed, and all the other dignitaries on the high table, distinguished participants. Let me just say a goodwill message on behalf of the Director of Pharmaceutical Services, Kano State Minister of Health. I was feeling the presence of the Permanent Secretary, also Minister of Health, is enough. He's been here is enough, a representation of all the people, or all the pharmacists in the Ministry of Health. However, I will still say a word on behalf of Pharmacist Kamil Moody, who is saying a very big congratulations to this great hospital for hosting this great event, World Pharmacy Day, with a very beautiful theme, Think Health, Think Pharmacist. So on behalf of the DPS, I congratulate Dala for this, and I wish us a very good celebration while looking forward to having more of these activities in the years ahead. So I welcome everybody. Thank you very much.
Well, thank you very much. Thank you very much. If you actually listen to the head of pharmacy department, she spoke about our effort, deliberate effort at building relationship. That is why the next goodwill message, before we take the final one, is a video goodwill message from Mr. O.T. Onatunde. The pharmacist here knows him. He's the pioneer head of pharmacy department of this hospital. He just turned 80 in April, and he's still committed to the cause of pharmacy service in this hospital. That is why he took his time to send this goodwill message for us. So I invite us to do him the honor to listen to him, 80 and still working stronger. Maybe you get one injection where pharmacists they collect. I will come see you now, so that when I reach 80, I will still be strong as this. So please. All right, thank you very much. Thank you very much. Now, on a serious note, now we go to the last speaker on this very goodwill messages segment of this program. May I, with humility, request the guest of honor, the person of Pharmacist Ahmad Ibrahim Yakasi, who is the MD of Chief Executive Officer of Pharma Plus, and the Kachallan Kanu, to give us his goodwill message. Thank you, sir. Thank you very much. I've dropped a microphone there for your convenience, sir.
Well, MC, you have murdered the program. Special guest of honor, not a guest of honor. And it's a remark, but special guest of honor. I wanted to really cherish you for emphasizing that, yes, health system, there will be no health system without pharmacists. You keep on echoing that, but now I have withdrawn. I will not give you anything. The chairman of this occasion, the permanent secretary, Minister of Health, Pharmacist Bashir Aminu, who said, I am his mentor, but I want to tell you, he's my very good friend. He is also my mentor, in other way. My good friend, the medical director, who is a friend of pharmacy profession. And I want to nominate you because we have award, what we call Friend of Pharmacy. When I was the president of Pharmaceutical Association of Nigeria, I initiated it, and we gave so many. For you to be the first to approve consultant cadre And the way you are doing just the way Ibobi, Ibobi Hospital in Lagos is doing, we must appreciate you. I will send the recommendation to the President Pharmaceutical Society of Nigeria so that you can be, coincidentally, the conference is coming off in Kano, so you'll be the connected here by the grace of God. So you are a true friend of pharmacy profession. He was whispering to me that Dala is 66 years old. I said, well, only 1 year older than me. What is my contemporary? Madam, you are doing well. I appreciate you. All other protocol of that. In the name of Allah, who makes all things possible, who made this occasion, very momentous occasion, possible. It is a World Pharmacist Day as decreed by FIP, International Pharmaceutical Federation, that on every 25th of September every year, we must reflect to show the world what pharmacy is all about. This day, to me, serves as a poignant reminder to the critical role of pharmacies globally. And I know, as we commemorate, we must recognize the role of pharmacy when it comes to medications, safe use of medication, when it comes to health education, when it comes to ensuring that we the patient output right. But I'm so happy this champion of collaboration, interprofessional collaboration, he realized the importance of pharmacists. By so doing, pharmacists, they are integral to managing pain. If you want to be painless, you must reach to pharmacy unit. If you want to have medication regimen for patients that are undergoing surgery or rehabilitation, they must reach pharmacy. If really you want to prevent infections, you must reach pharmacy department. So, in Dala, pharmacists are doing a lot to get to this. Think health, think pharmacist. Of course, we're talking of self-medication. In all ramifications, we're talking of custodian of safety. We're not only custodian of drugs, we're custodian of safety. We have to improve the way we do medication prescription to check the medication errors. We have to look at the adverse drug reactions, pharmacovigilance. Either we like it or not, from now on, NAFDAC will not accept any drug that has no periodic safety update report, either renewal or new product. So they are taking adverse drug reactions seriously, and pharmacists are championing it. They are working very hard to see they do that. Then promoting education, health education is very important. That's why FIP has been working on the issue of education. Literacy, we have to show the patients, we have to share the knowledge. That's one good thing about pharmacists. We are not greedy, we are not selfish, we share our knowledge. We distribute knowledge. We distribute all kinds of things that we do. And then, of course, the chronic disease management, we are there. That is why, particularly, my company decided to go into pain management and, of course, all kinds of disease management by bringing all kinds of products that will fight infections and pain. So that is our own specialization. So I'm so happy that, yes, the law orthopedic pharmacist, I have seen, I have watched, I can see it vividly clear that you are working closely with the team of healthcare in Dala Orthopedic Hospital. That's a thing of joy. you are walking the talk as far as interprofessional collaboration is concerned. I champion that. I still believe in that. And I'm so happy the medical director believes in that. It's not the issue that, yes, I am in my own lane, I remain there. No, it's not about that. Even cleaner is so important. What else? Your colleagues, medical doctor, nurses. In those days, we were trained together, doctors and pharmacists. And sometimes, when it comes to pharmacology, physiology, all we show them, we beat them. Anatomy, but sometimes we have to, first year, we have to go and see cops. If you, actually, I got admission to be a medical doctor, but I said no. I enjoy seeing chemicals. I want to see how to mix two chemicals to see a powder. I want to see good manufacturing practice. The flow is so beautiful from the beginning to the end. I want to see myself discovering products. I want to see myself doing clinical trials, all through from pre-clinical trials to the end. I mean, it's so beautiful. You have seen so many fields. And I want to assure you, with the West African Postgraduate College of Pharmacists, we are specializing in all areas, critical areas. In Lagos, in Enugu, they cannot do kidney transplant or any heart problem, surgery or whatever, without a pharmacist. They always wait for pharmacists. So pharmacists, Dala, create it. I know in Americano sometimes there is one pharmacist that they are always, doctors don't want to go around without him present. That is important. So we have specialization. That is all about consultant cadre. And thank you for approving consultancy cadre in Dala Hospital for the World. May God continue to bless you. Ladies and gentlemen, today we are celebrating our heroes, pharmacists, for the critical role they have been playing as far as patient is concerned. And I want to appeal to you to stand up and give them a standing ovation for what they have been doing in the hospital complex. Pharmacists, well done. Let's stand up for them, and they are our heroes. Yes. Thank you, pharmacists. We acknowledge your dedication, your expertise as far as healthcare system is concerned. I want to thank the organizers for this year's World Pharmacist Day, the participants, and indeed the management, particularly the medical director, for always giving the opportunity, the conducive environment for them to thrive. And I want to really appreciate the community, Dala community. I was so happy when I see the chief imam of Gomaja Mosque here. You are welcome, sir. And I want to assure you that we are all for you. We'll continue to serve humanity, and we love you. We love you, we love you. May God bless you pharmaceutically. Thank you very much.
May God bless us pharmaceutically. I love that one. I love that one because I listened to the orthopedic surgeons at a point in time, and they told me that I listened to them saying that there is one thing nobody can escape from in life: musculoskeletal issues. That so long as you live, there you will never escape from that. But today, the pharmaceutical society have lifted that from us. We are pharmaceutically blessed, so we are not bothered with that. Thank you very much, sir. Thank you very much, my special guest of honor. Thank you. This is fast pen, and may I quickly, without much ado, invite to the podium pharmacist Isabella Elogun to facilitate us on this next item, which is the introductions to citation of our keynote speaker, pharmacy. Is that?
Good afternoon, ladies and gentlemen. Permit me to stand on the established protocol. I am pharmacist Isabella Elogun, and I've been given the privilege to read out the introduction of our keynote address speaker for the day, in person of Professor Mohammed Garba Magaji, B.Pharm, MSc, PhD, the current Dean, Faculty of Pharmaceutical Sciences, Ahmadu Bello University, Zaria, Nigeria. Professor Mohammed Garba Magaji is a distinguished pharmacologist and academic leader with over 2 decades of experience in teaching, research, and clinical practice. He obtained his Bachelor of Pharmacy, Master of Science, and Director of Philosophy degrees in pharmacology from Ahmadu Bello University, Zaria, where he currently serves as the Professor of Pharmacology and the current Dean of the faculty. He holds a master's degree in risk management, in risk and disaster management from the same institution. Professor Magaji's research focuses on neuropharmacology, ethnopharmacology, and the discovery of novel therapeutic agents from medical plants with special interest in snake envenomation, central nervous system disorders, and reproductive pharmacology. His passion lies in translational pharmacology, bridging indigenous knowledge and modern science to develop innovative therapies. He has published over 200 peer-reviewed articles in reputable journals and has supervised more than 6 MSc and PhD students, he has published over 200 peer-reviewed articles in reputable journals and has supervised more than 60 MSc and PhD students, significantly contributing to the training of the next generation of scientists and pharmacists. His scholarly excellence has earned him numerous awards, including the Outstanding Research of the Year Award in ABU in 2024, Best Researcher Award, Faculty of Pharmaceutical Sciences 2024, Best Postgraduate Lecturer Award 2018, and the Outstanding Performance Achiever Award 2025. Internationally, he has been recognized with prestigious fellowships and grants, such as the International Brain and Research Organization Fellowship in 2013 and a postdoctoral fellowship at Northwest University, South Africa in 2014. Professor Magaji is actively involved in professional associations. He previously served as Public Relations Officer of the West African Society for Pharmacology and is the current Secretary General of the college. He also serves as the Secretary General of the Nigerian Association of Pharmacists in Academia, where he contributes to strengthening academic pharmacy and professional collaborations across the country. Beyond research and professional service, Professor Magaji has demonstrated strong leadership in academia and continues to advance the frontiers of pharmaceutical sciences in Nigeria and globally. His research interests encompass central nervous system drug discovery, medical plants in reproductive health, and envenomation, as well as the development of novel therapeutic molecules for epilepsy, depression, and erectile dysfunction. Professor Mohammed Garba Magaji is widely respected as a mentor, scholar, and administrator whose career reflects an enduring commitment to innovation, indigenous knowledge, professional service, and the global advancement of pharmacological sciences. Once again, you are most welcome, sir, as you give us your symposium lecture. Thank you.
Thank you very much. Please continue to appreciate. It's not easy. As we are putting your hands together, head of pharmacy, I'm thinking we should take our own back. Maybe here we start. We should collect it from maybe you back to us. That would be a disservice to humanity. You're welcome, sir. أعوذ بالله من السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. The chairman of today's occasion, the Permanent Secretary, Minister of Health, Kano State, Pharmacist Aminu Bashir, our distinguished pharmacist, Pharmacists. We thank you for graciously accepting to guide the flow of this all-important program, for lending your presence to this important occasion of the World Pharmacist Day. Our special guest of honor, the first of the first, the mentor of mentor, the father of father, the trainer of trainer, pharmacists, 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 the greatest pharmacists to have come out of this noble state of Kano State. I can say that without fear of contradiction. Pharmacist Ibrahim Ahmed Yakasey. My father, my mentor as a student, let me quickly remind him that he fondly called me Kano Jigawa because I represent, he was an ESCO member of Kano Jigawa Pharmacy Student Association. He was a mentor to many of us, he's still a mentor. Sir, we greatly appreciate you. We are deeply grateful for your commitment to pharmacy, to healthcare, and your continued support to the profession of pharmacy. The Director of Pharmaceutical Service, Kano State, Pharmacist Kamil Lumudi Salisu, ably represented by my brother, Pharmacist Mustafa Usman Ibrahim. Sir, we are indeed very grateful as your present add color and way to this important occasion. We sincerely appreciate you, sir. To our chief hosts, the Medical Director of National Orthopedic Hospital, Dala Kanu here, Dr. Nurdin Isa, as was rightly mentioned by the Director of Pharmaceutical Services, National Orthopedic Hospital here. I cut my professional teeth in this great institution. And during that period, sir, I think you were the chairman of the Drug Revolving Fund. And I will also give this testimony that pharmacy enjoy a lot of support and cooperation from you, even for us as intern pharmacists. I fondly remember when we came, we were given the opportunity to learn, to explore. I think my colleague, pharmacist Aibomosi Bruno is here. We came here and met the complete one-stop system where drugs are displayed on the table. And went to pharmacist Ainde, who was the principal pharmacist, and told her, Ma, we want to be held responsible. We want to have individual lockers as pharmacists. She said, okay, put into writing. We did that, and it was sent to the Iron Lady, pharmacist, Bolaji Bosse Pray. Then it was sent to pharmacist Oti Onatinde, and the attention of the DRF chairman was called. And I tell you, the following week, we saw the individual locker. Just a week. And our effort yielded fruits. So we're indeed very grateful, sir. To the hosts, my own big sister, Director of Pharmaceutical Services and Head of Department, I must commend you for organizing all this important occasion. Sincerely, this is going to be highly impactful. Other members of the high table, I think I can just mention some of them because I cannot go without mentioning my great father, pharmacy, Amin Usman sir. I remember Pharmacist Amin Usman coming purposely to Ahmad Bello University Zaria to ask me to register for the West African Postgraduate College of Pharmacy. I told him, sir, very soon I'll become a professor. I said, no, you must be a fellow of West African Postgraduate College. I want to tell you, sir, that currently I'm a student of West African Postgraduate College of Pharmacists. To other distinguished members of the high table, whose daily work sustain and health, I salute you all. The high table on this side of the divide, my Ebudin sir, Pharmacist Ibrahim Ademuyaka sir, Dean Faculty of Pharmaceutical Sciences by University Kano, sir. I agree to. Pharmacist Musa Abdullahi, I think my first internship offer I got was from AKTH. But as Allah will have it, I switched to National Orthopedic Hospital for a reason that I cannot really tell. But now I think I can vividly tell that without slighting my big brother, sir. To other invited guests, we are delighted to have you share this moment with us. And finally, to our ever energetic ladies and gentlemen, thank you for being here and for making this gathering a wonderful one. Having duly observed this protocol, Mr. Chairman, sir, permits me to turn to the theme of this year's celebration, Think Health and Think Pharmacist. It gives me great honor and joy to be here today. But more than joy, it gives me a great sense of gratitude, because this hospital, National Orthopedic Hospital, Kano, is not just an institution to me. Over 20 years ago, precisely in the year 2000, I walked through these gates of this hospital as an intern pharmacist. I was young. Arguably, I was the youngest. Yes, I'm still young. Thank you for correcting me, sir. I was the youngest of the intern pharmacists there. So each time we have issue, they push me, go and meet pharmacy, and they go and meet her, go and tell her a problem. And of course, seeing me very small, she said, my boy, what do you want me to do for you? I said, this time around, we want you to change this curtain. I said, okay, we are going to do it for you. I was young, eager, and ambitious, and determined to serve. And the lesson I gathered here shaped not only my professional journey, but also my philosophy of the profession of pharmacy. We were mentored, we were encouraged, we were given room to explore. Dala Orthopedic Hospital had not just started this. Right from its inception, she always encouraged her intern pharmacists, and I was one of them. I remember, I also told pharmacists on a day like this, that we've been having this pharmacy presentation at the departmental level. Why can't we go to the hospital level? We want to go and present to the doctors. Let them feel the stuff we have in us. He said, okay, put into writing. She's fond of doing that. Okay, go and write it down. How do you want it to be done? So we wrote, Pharmacy on Atinde, the then chief pharmacist took me, the youngest, and we walked straight to the medical director, I think Dr. Popo Oladin. We got there, he said, okay, make a presentation. I did. I said, we want to present, we have something to say about antimicrobial stewardship. We never knew it was going to be a big issue now. And the title of the presentation was Antibiotic Drug Resistance, the Role of Pharmacy in Combating the Menace. And we're given the opportunity to present to the larger university committee. Thank you very much, sir. May I quickly extend my sincere appreciation to our teachers, our mentors, Pharmacists on Atinde. We are clocked 80 in April. The Iron Lady, Pharmacy BB Pray, and our tireless Pharmacy Teni Aide, our chief host today. Today I return to this great hospital. Today I return to the great National Orthopedic Hospital, Dala Kano, not as an intern, but as a dean of the Faculty of Pharmaceutical Sciences of the largest university south of Sahara, Ahmadu Bello University Zaria. I'm deeply honored to speak to you on this special occasion, the World Pharmacist Day. And the team, quite apt, very strong, very supportive. Think health, think pharmacists. Many of us will see the team as very simple, but the team is so pregnant. The team is so powerful. When you think health, you think of any other professional but the pharmacist. Mr. Chairman, sir, permit me to ask that when we think of health, if I ask this gathering, that which set of professional would they think about? Many will mention the doctor, the nurses, and of course, the orthopedic surgeons, since we are in the National Orthopedic Hospital, Dala Kano. I agree with you, all of them, yes, but I challenge us today to also think of the pharmacy, because without pharmacy, the story of health will be completely incomplete. It will be what? Completely incomplete. Because pharmacy are the center of healthcare delivery system, not only in Nigeria, but the world over. I want to support this my assertion with 3 fundamental truths about the profession of pharmacists the world must never forget. Of course, we appreciate, but we must not forget them in a haste. The first truth is that pharmacists, these are 3 fundamental truths. The first one is pharmacists are medication experts. The second one, pharmacists are patient advocates. And the last but not the least, pharmacists are innovators and leaders. We all agree that the most important intervention for most of the patient is with drug, with medication. And we all believe that medication actually saves lives. But according to Paracelsus, all drugs are poisons. What separates drug from the poison is what? The dose. We all appreciate that this drug that we are taking can also harm us if they are used wrongly. Drug can be abused, drug can be underused, can be overused, can be misused. And who is that professional that stands between the medicine and the patient? I ask, who is that professional that stands between the medicine and the patient? The pharmacist. Please echo this. Who is that professional? The pharmacist. Please, thank you very much. Please, let's participate in this short talk, please. It's just going to be for just some 5-10 minutes. The pharmacists are those professionals that stand between our medication and the patient. As an intern pharmacy, there was an event that took place. And I believe the National Orthopedic Hospitals lived these truths every day. A patient was recovering from orthopedic surgery and he was prescribed a painkiller. Of course, when we say painkiller, we say the analgesic, right? Mostly we use the non-steroidal anti-inflammatory drugs in this part of the world. On its own, the prescription in the chart was okay. But the pharmacist, upon reviewing the chart, noticed the patient was already taking another medication, which when they are combined with the painkiller, is going to predispose the individual to dangerous internal bleeding, particularly gastrointestinal bleeding, because the patient is on and was on anticoagulants. The pharmacist intervened, the prescription was adjusted, and the patient recovery was very safe. That is the responsibility of pharmacists, ensuring safe medication. And many pharmacists have actually gone extra mile to ensure that medication are used rationally. Pharmacists are in the forefront in the prevention and advocating against substance abuse. That's pharmacy for you. And this is not an isolated case, especially for those of us that are in community pharmacy. We see this almost on a daily basis because everybody can prescribe. We don't even leave it to the physician alone. Every person, the nurse and what have you, everyone can prescribe. So at this non-isolated case, in another hospital, a patient came with a prescription of antibiotic, particularly aminoglycoside, the gentamicin and the associates. When you look at the prescription, it was very fine, but the dose was 10 times what can be used. And you know that once that patient takes that drug, in just a few days, the patient can come down with acute renal failure. The pharmacist saw this also, called the attention of the prescriber. The prescription was corrected, and the patient was saved and, of course, healed. That is pharmacy in action. These are not just dramatic stories. They are daily realities. We see every day. Because those that are doing the prescription are not what? Angels. They are human beings like us. They are not doing it purposely. It's an error. That's human error. And that's why pharmacists, as custodian of drug information, they have all this information at their fingertips. And they can easily correct it to save the patient. Every day across hospital, pharmacists quietly prevent harm and save lives. And you know what? When they do this, they don't make noise. That's their responsibility. Several lives are saved. And we don't make headway. You don't go and publish it that, oh, a pharmacist has saved the life of so number of patients in this hospital. No. If you see us doing that, it's for publication's sake. Just to educate, for education's sake. But it's not to make headway. Oh, a pharmacist has saved the life of 100 patients in national hospitals. No. We are doing it because it is our responsibility. So when you think of health, you think of pharmacists. The second truth is that pharmacists are patients' advocates. Of course, when advocate comes, you think of the lawyers, right? So pharmacists should be part of the law profession. And when I see pharmacists that are trained as lawyers, I'm impressed because they are greater advocates. Pharmacy is no longer just about counting medication or labeling dispensing bottles. It's about people, the patient. And this is the beauty of our profession. For you to actually see a pharmacist, in most cases, you don't need an appointment. They are the most accessible professional. In fact, a particular literature actually captured that pharmacists are 10 times more accessible than most of the professionals. Pharmacists, they are the most accessible professional. You don't need prior appointment to see a pharmacist. You walk into a hospital pharmacy, a community pharmacy, or even a rural outreach program, and you find a pharmacist sitting there waiting for you to counsel you, to listen to you, to support you. That's what the pharmaceutical calling. Always there to advocate for the right of the patient. Studies have shown that patient visits pharmacy nearly twice as often as they visit physician. In fact, I said that is in Obodo Oyinbo. In Nigeria today, I think that should be 4 times. Yes, patient actually visit pharmacists 13 times a year versus 7 in some settings. The frequency is even higher for patients that are having chronic ailments, diabetes mellitus, asthma, hypertension. And for people that are living in rural areas where you don't even have access to quality service of physician. So when you don't even have pharmacy there, they visit what? The patent medicine store. Pharmacy, we do not need appointment because pharmacies are close by and often open longer hours, and pharmacies are truly the front door healthcare. That's what a particular literature describes pharmacies. Let me quickly take us back to the period of COVID-19 pandemic. Lockdown actually restricted for us, if you can remember, a lot of restriction. Clinics were actually overwhelmed. Many people are coming down with COVID-19. Hospitals were stretched to the limit, but pharmacies stood firm. Many hospital and community pharmacies kept their door open. Patients who needed blood pressure medicine, anti-diabetes such as insulin or inhaler for asthma, found pharmacy always available. Some pharmacy even personally delivered medicine to the doorstep of patients. I know one in Zaria. Ensuring that no one was cut off from essential medicine. That is pharmacy in action for you. So this is what is meant to be an advocate for the patient, always there to assist the patient in solving their health-related challenges. Pharmacists counsel, pharmacists monitor, pharmacists encourage. We guide patients to adherence. You see pharmacists calling patients very late in the night and asking, have you taken your medication? That's our responsibility. Because we do know that without effective adherence, therapeutic failure is going to set in. So as pharmacists, we ensure that the patient adhere to their medication so that we can achieve all outcome, therapeutic outcome. Holistic outcome is what we are interested in. When I was in the hospital, my chief pharmacist then was asking me, there's a particular patient we were having then that was having diabetes mellitus. Non-cooperating patient. I was the one in charge to call that patient. I'll call, Baba, have you taken your medication? Okay, and then I'll take it now. I'll just take my medication. Please go and take it. So this is the responsibility of pharmacists serving as a patient advocate. So we are not just dispenser of drug. We are part and parcel of healing, companions on the journey to discovery. The last truth is that pharmacists are innovators and leaders in their own rights. Our profession is the most dynamic profession. I can say it without fear of contradiction. Very dynamic and very innovative. Whenever we see areas of practice that's going to advance the healthcare of the patient, we delve into it and take it as part of our own calling. All what we are interested in is what? Effective delivery of healthcare to this patient. Pharmacy at the forefront of research and development, discovering new drugs, formulating new dosage forms. You have seen there are several dosage forms that when I was an intern pharmacy, we are not seeing them.
It's just tablet capsule, and the capsule is just gelatin capsule. We are not having nanoparticles, less what you call dosage form. But today, you are seeing many innovations, many patches and what have you, inhalation, enema, all of them with sophisticated, measure to ensure that effective delivery of this drug are achieved. Now, pharmacists are also tapping into the rich Nigeria medicinal plan for novel therapy. Today, we have actually gone through several trials to discover new medication. Just about a few years ago, we got a particular plant called Secunega virosa. It is called Itachengado, Buakare. In Yoruba, it is called Eronje. In Igbo, it is called Injisinta. This particular drug was very effective in the management of cancer. We took the extract of this plant and took it all the way to University of Virginia in America. And we tested it against the cells of glioblastoma multiforme. Glioblastoma is a form of glioma that even after diagnosis, even with medication, the lifetime expectancy is between 3 and 6 months. After diagnosis, even with there's no medication, after diagnosis, it just starts counting days that this patient is going to die. Interestingly, after we administered this particular herbal extract, it was able to kill the cancer cell lines. And we realized that it was actually downregulating the epidermal growth factor receptor, which is actually responsible for the expression of this cancer. Recently, we've been able to carry out the xenograft model in mice, and we also realized it's actually very effective. So we are just a little step before we reach the stage of clinical trial, and we are hopeful that if we're able to make this discovery, some of us will be on our way to for the Nobel Prize, inshallah. Also, pharmacists are leaders in public health, driving vaccination campaign, antimicrobial stewardship, the one I talked about initially. We never knew that was going to be an issue. But then we met our chief hosts, and we told them we want to present to larger university community. Pharmacy Bruno, you remember that? Yes. It was a huge success, and the hospital actually appreciated us for that. And a lot of things changed in the hospital after that our presentation. So pharmacists are involved in public health driving vaccination campaign, antimicrobial stewardship, and community health education. Pharmacy are also leaders in administration. Anywhere you find a pharmacy, if it's a leader, it's going to be an effective leader. I'm not surprised with all the accolade that pharmacy Tenny India has actually received this morning, because pharmacy are actually trained to be effective leaders. We are involved in designing hospital formularies, managing procurement, and ensuring integrity of medicine supply chain. Without pharmacists, medicine might not only be unsafe, they might not even be available altogether. Maybe it's when you see the medicine. The medicine may not even be available without effective pharmacy management. And let us not forget technology. Today, telepharmacy, where a pharmacy can stay in Zaria and be consulting with a patient in rural area in Kiru local government. That is telepharmacy. We are there today. Artificial intelligence is changing, the world of healthcare delivery system today, and pharmacy are actually keen into this. Digital health and reshaping healthcare. Pharmacy must embrace this for effective healthcare, predict risk, and improve outcome. Whenever health innovation or policy is discussed, the pharmacy must be at the table. So, call for action. What do we need to do? So, what does it mean for us here at the National Orthopedic Hospital here in Nigeria? It means that we must strengthen clinical pharmacy practice. Today, we are having 25 schools of pharmacy in Nigeria, and 23 of them have already migrated to Doctor of Pharmacy program. I'm very happy to say that the Faculty of Pharmaceutical Sciences by University of Kano have already graduated their first set of Bachelor of Pharmacy product. Of course, it is important to highlight the transformative role of Doctor of Pharmacy program. It's not just it's a paradigm shift. In fact, it's a paradigm shift in pharmacy education that equip pharmacists as frontline clinicians, researchers,